Good afternoon and welcome to another edition of Ask the Doctors on Whitewater Community Television's WGTV Channel 11, WCTV Channel 21, and streaming on Facebook Live. We opened the show. You know, we've been doing this show for, I'm not even sure how many weeks, 14, 15. I never really thought it would go this far, but we start this show having just gotten a press release from the governor's office that says he did sign Executive Order 2037 requiring face masks. That begins on Monday, an increase in overall hospitalizations from 600 a day at the end of June to approximately 800 now. Highest number of cases in a single day with 1,100 Hoosiers reported positive today. A rise in COVID-19 positivity across the state from 3.6% a month ago to nearly double that percentage now. Those are probably not numbers that you all want to hear. Our doctors, Dr. David Jetmore, Wayne County Health Officer, Dr. Thomas Huth, Vice President, Medical Affairs, Reed Health. Gentlemen, thank you once again for joining us. It has been a busy week locally and statewide. Dr. Jetmore, what have you learned this week, or what do you want to pass on?
Well, I think everybody is aware that the number of cases in the United States and in Indiana, and most importantly in Wayne County, are going up. And I think this is a direct result of us going back to doing what we were before, businesses, jobs, socializing, and without mask, and not maintaining social distance. Not an accusatory thing, but I think it's obviously a cause and effect. So I think the governor is kind of forced to mandate that we, at a minimum, wear masks indoors, Eric, and whenever we can't keep that 6-foot distance when we're outside. I know that none of us wants to wear a mask. It looks unmanly to a lot of men. It is stifling. It's confining. I didn't like wearing a mask all the time as in my career as a surgeon, but it is something you get used to. And I think when you realize the amount of good you're doing by wearing a mask, it makes it a lot easier to go to the trouble of putting one on. But the governor and I think our local health department and our county commissioners realize that the time to do this is when the numbers are low. We really haven't had a first wave here in Wayne County. This is more like our first wave here. We've kept these numbers and the number of deaths really tamped down. And the bad side effect of that is people aren't aware of all this disease that's out there because we've kind of had this little oasis here. The time to increase these restrictions is before these numbers get insurmountable. What happens, Eric, is if you get enough of these cases, the traditional way is someone has coronavirus, we call them and do contact tracing. Who have you been around for within close quarters for 15 minutes, and then we call that person. And we round these people up, advise them to self-isolate, and that's how you tamp down disease. If these numbers get out of control, it becomes almost impossible to do all this contact tracing. That's the problem they have in places like Texas and Florida. So it's discouraging to see these numbers go up, but it's also heartening to see that we're responding to this, because if we do this simple thing, putting on a mask and distancing ourselves, we can continue on with our lives. I mean, at least in the short term, it'll be lives where we're wearing a mask, but we won't have to shut things down like we did in such a draconian fashion earlier in the year.
Dr. Huth?
Yeah, so, I mean, I agree completely with everything that Dr. Jetmore has said, and we just like to not see the numbers get so high that it has to be considered whether to curtail services, enforce stay-at-home orders and that kind of thing. We don't want to get back to that point. So the question is, what can we do practically to avoid that has any chance of helping? And it really is, it's the same basic fundamental things, But I think as time goes on, we've really learned the value of the masking. And so I think that's probably the biggest, the single most important thing we can do for each other is to really wear our masks, consistently and correctly, and just get everybody on board with that. I've noticed even the president is now saying he's on board with masking, he's getting comfortable with wearing it, and so I think there's beginning to be a lot of consensus around the value of masking.
I think one of the things that's confusing to the public is that we've given them mixed messages. We've said things on this program that later we backed off from. We were wrong. I can remember sitting in this chair and telling you, no, we don't need to wear a mask, because that's what the World Health Organization said. And the initial reports is this virus didn't travel very far on your expelled breath, and that but I think the main reason is we were worried that there was going to be this tremendous rush by the private population for PPE, and there wouldn't be any left for people in the hospital, the frontline workers, to take care of people who are sick. So I don't want our viewers to get discouraged when they hear, well, like 2 months ago, they said exactly the opposite. That may be the case, because that's the nature of science. You have an idea, you have good reasons to believe that, and then guess what? It's proven wrong. And you have to regroup and change your thinking. So we give the information that we think is the total up-to-date valid information on this particular day, but things change, and I think that's confusing to the public.
Things do change, and with COVID-19, they've changed very rapidly. I think a lot of people don't understand the reality that things in science, things in medicine change over time. Now, you and I have been involved in this business, you significantly longer than I have, but I have for 35 years. Not that you're old or anything, Dr. Jetmore. I wasn't
really sure where you were going with that, but I was going to let it go.
Because my 35 years in the business, I am not old either. But I think you would probably agree, I would hope, that over that time we've seen things change dramatically, things that we did 30 years ago that we would think that we believe are crazy today. Can't believe we ever did that. To the average person, those kinds of changes, they've come about so gradually, people really aren't aware of them, that they change. And but with COVID-19, the issue is they've changed very rapidly, much more quickly, a lot more change in a shorter period of time, and so it's more noticeable to everybody. So 2 months ago, we were giving people the best advice we could on the science that was available at the time. Since then, there's a lot more data, and you mentioned correctly that there's a lot more availability of PPE. The availability of PPE at the hospital is really not an issue now. It's something we track and manage. Want to make sure that doesn't become an issue again, but it's not like it was 2 to 3 months ago. So a lot of factors that were in play then are no longer in play now. The big thing is, in my mind, 2 to 3 months ago, the best advice we could give was simply based on laboratory testing of mask filtration ability, and even medical masks don't have much filtration efficiency for particles the submicron particles the size of virus particles. That's what we knew then, but what we've since have realized is that if I'm carrying COVID-19, I'm not expelling single viral particles. They're riding on droplets. They're riding on vapor, basically vapor conglomerations that are coming out. And the whole trick to making masks work is to trap those kinds of emissions close to the emitter. That's where the most value is. And so we've been working on that's what we realize now. That's what's worked in places like Taiwan, which I have mentioned before. Mm-hmm. It's a country that has 40% more people in it than the whole state of New York, has twice the population density. You would think that that would be a terribly risky situation, but the reality is They've had 0.1% of the cases of New York State, 0.02% of the deaths, and the thing that they all do, it's a cultural thing. They don't have to mandate anybody do it. They all wear masks in public. They do the same things we do, except that they don't fight back on the masks. So that's probably the biggest thing that I think we've come to realize since then, and there have been other reports and anecdotes and additional science coming about the value of masks. I mentioned last week, I think, about the CDC report of 2 hairstylists in Missouri who were both COVID positive and worked for a week, came into contact with almost 140 clients over the time that they were working while sick, and not one of those individuals actually came down with COVID-19 transmitted by the stylist, because the salon very consistently enforced the masking rule for the stylists and the clients. And so that's a vivid example that even low-quality masks like cloth masks that are homemade have value if correctly applied.
You're watching Ask the Doctors on Whitewater Community Television's WGTV Channel 11, WCTV Channel 21, streaming on Facebook Live. We will talk with the doctors a little bit more this hour about maybe some of what else they have learned over the last couple of months. I guess we've been at this now, a few months we've been at this. We are taking your questions. You can put them on our Facebook page. You can also send them in tweet to @WCTV Info. We're going to open this conversation up, hanging out in our Zoom room, I guess, as it were. We have one of those now, is Christine Stinson, Executive Director of the Wayne County Health Department, masked up in her office, I assume. Christine, how are you today?
I'm doing well. I forgot it was a Zoom meeting. I can take this off since I'm by myself. But thank you guys for having me on here.
I'm going to kind of step back. I know, let's start with the fact that you just put a mask on, and masks are something that you all are trying to get out. Why don't you start by providing some information about the masking event, mask giveaway that is taking place tomorrow in 3 different locations around Richmond.
Right. Simultaneously in 3 different locations in Richmond, we're having another mask event where we'll be giving out the disposable mask. Each car that comes through will get a box of the disposable masks, and these have 50 masks in them. So each car will get a box of these, and they can provide their family with masks or themselves. We'll be having one event will be at Test Middle School. The other one will be at the Pace Center, and Reed Health will be running that one. And then we're also having one down at the you have to help me out with the Estro Park.
Estro Plaza.
Estro Plaza. And the city of Richmond will be running that site. So this is a partnership with the county, the city, and Reed Health. You can see behind me, we'll also be giving out these signs that Reed Health has provided that look like the signs that we were holding up and everyone was posting on social media. Reed Health had those made up that you can put in your yard. And so they're kind of yard signs to publicly, let everyone know why you're wearing the mask. And I wear my mask for my community who I love and I want to protect. So we'll be handing those out along with the mask. So come down, it's from 12 to 3, like I said. I asked how many masks will we be able to give out? At what point will we have to stop? And I was told, Christine, there's no way you could possibly give out all of the masks that we have available to give to the community. And I said, challenge accepted. I will try to run out of masks tomorrow. So come down. Like I said, every car will get one. We've had people that have asked, if I bring my neighbor down who doesn't have a car, will I be able to get 2 boxes of masks? And the answer is yes. You will be able to get 2 boxes of masks if there's 2 different households in that car.
Okay. Doctors, I'm going to let you have the floor.
Christine, why don't you talk a little bit about the numbers that are being tested in the Optum site right now and what the future is for the Optum site?
We did see a little bit of issue with the Optum site. We lost some of the employees. So Optum Serve is a a partnership with ISDH and the Optum Care. And so we noticed that they were starting to turn people away from the site. So I asked the site manager what's going on. They said, well, we lost one of our swabbers. And I quickly called the state, asked them if they knew that. They were not aware of that, and we've got that back. So the Optum Serve site is back to taking walk-ins. If you were turned away from that Optum site, please return back, because we do have it back staffed up enough. This week alone, every day we've tested over 130 people. Our goal is to test 130 a day, and we're testing over 130 each day. The only day that was low was the 20th, and we tested 124 that day. But hopefully with that second swabber, we'll be up around 200 again, because we were, before we lost that one, we're around 200, between 160 and 200 a day that we were doing. So testing is a key part of controlling this outbreak. The more that we can test and see where it is at, and better define where the quarantine and isolations need to be, the better we're going to fare through this. And that will keep our schools open longer. It will prevent us from having to step back into phases. So the masking is another key component. Our Board of Health 2 Thursdays ago, asked that there be a mandate in Wayne County, because we had been asking the governor to do this, so Indiana wouldn't have a patchwork of different ordinances and regulations and mandates and looking really wild. You wouldn't know where you were going from one county to another. He said he wasn't quite there yet, but then when he started seeing counties like ours, like Clark County, that had really maintained our numbers pretty well through this, suddenly take that sudden and drastic increase, where we went from having 2 to 3 cases a day. We would get really kind of nervous when we'd see 4 cases a day, to a jump to 20 cases a day, 16 to 26 cases a day. That was a big increase. And so we're happy that he passed that mandate. So Indiana will have a clear guidance of what is expected when you go from Wayne County to Henry County to Grant County to St. Joe County. We're all going to be looking the same. And we don't have to worry about, I've crossed a county line, now what do I need to do? And I think that when you have better, clear guidance from the state and from the federal government, the less we get this misinformation and confusing information. One of the things that was confusing was the mayor had came out with a statement the same day that the governor came out with his statement. And so people were confused. Well, who do I follow, the mayor or the governor? Because, and so our messaging has to be clear. And I think when we have statewide mandates, rather than the patchwork of county, it's always better for the citizen. And clear messaging is very important.
How long are people having to wait for their test results? How do they receive their test results? And what's the future of the Optum site looking ahead?
Okay, those are great questions. So I just got on my site where I can see the Optum Serve results, and the people that were tested on the 22nd are getting their results today. So about a 2-day turnaround time. We're not seeing the long 5, 6, 7 day turnaround times. Now that's not to say that an outlier will have an issue where something happens and stuff like that, but routinely it's in that 48 to 24 hour turnaround time. I personally would love to see that lessened. I think that the more time in between you getting tested and you getting the results, a lot can happen. I would love for the state to get the rapid response or the rapid test, where we can be with the patient, talk to them then immediately about the importance of isolation, contact tracing, getting in contact with those contacts. And it starts to become a daunting task the farther out you get from knowing when you're positive. So that's one of the things that I wanted to talk to people about was the importance of, if you are experiencing the symptoms of COVID, and you have went and you got tested, you don't have your results back, you should isolate. It's very, very important if you're sick to stay home. Don't wait for a test result to tell you that you're sick. Go ahead and follow those guidelines. And then if you do get that test result that says that you're positive, you start making the contacts to your close contacts and letting them know, hey, I tested positive. You and I were, in a car together for 2 hours. You're a close contact. You need to isolate yourself, because the state will be contacting all of them. But, just like, when everything's a delay, you could start it quicker than the state. By the time the state gets theirs, gets everything ready, and they start then to make your contacts, we could have already had a person in isolation for a day.
I think one of the things that really comes into focus when you think about the timing of this test, say you're an asymptomatic patient and you go in to be tested just because you can, see where you're at, and you don't get the test for 6 days, like the problem they have in a lot of parts of the United States, then you have no symptoms, you go ahead and live your life. Well, you've been shedding, typically you'll shed virus 6 days before symptoms and 6 days after you develop it, but you may be an asymptomatic patient that's shedding virus this whole 6 days, whereas if you found out earlier, you'd be able to isolate yourself. So we're fortunate to have 2-day turnaround when you look at what's happening in the rest of the United States. A 6 or 7 day old test is like yesterday's newspaper. It really has no value. Go ahead, I interrupted you.
No, you're right. It's like yesterday's. It's interesting, but it would have been more interesting and important if we got it yesterday. But what you talked about with the asymptomatic carriers and pre-symptomatic shedders. So you start to feel sick, you start running a fever and having a sore throat, your body starts hurting, and all of these things come on, gradually. You don't just boom, all of a sudden I have COVID. They're gradual symptoms that build up into I feel horrible. But as you come into those, you started being able to shed that virus 2 days prior to your first start of your symptoms. So what that tells us is the importance of masking. And a lot of times I hear people say, well, if you're wearing a mask, why do you care what I do? Why is that a big deal to you? Because if I'm not sick and I wear a mask, I'll get about a 30% reduction in transmission when I'm out in public. But if a sick person has a mask on and I also have a mask on, there's a 70% reduction in transmission when both of us are wearing masks. So that's why it's important that we're all wearing masks. And if we could get 90% of our population to wearing the mask, and I just read the governor just signed his order and it's just been publicized today. So I read over it, and one of my main thing was, well, how long is this for? It's for 30 days. I think we can do this for 30 days. And in those 30 days, the higher compliance we have with this and the better we do, the more chance that we're going to see that we can relax some of these mandates of mask wearing and the lockdown on the large gatherings and things like this. But while we have this uncontrolled spread in our community, this is where these restrictions have to come in. When you look at, if everyone could do case contacting and or case investigation and listen to the stories of the people that have had it, that survive it. It's a disease you do not want to have. It's very hard on your lungs. It's very hard on your heart, on your kidneys. I talked with a young man at length one day, and he had me choked up, thinking about losing his life and saying goodbye to his kids and stuff. It's a hard thing to listen to. And if everyone had to do that for a day, you might think, wow, maybe putting a mask on is worth it. If we could save one person from thinking that they're going to not be able to see their kids again, it's pretty powerful.
Well, Christine, I wanted to maybe ask you a couple questions. I think I heard that the Optum site was originally contracted by the state to the end of July, but that may have changed. What do you think is going to happen from here with the Optum site?
So they had extended the contract with OptumServe through the end of August now. So we do know that we will have the OptumServe to the end of August. And the state is now funding a grant for local health departments to pick up the local community testing, and have offered a grant for them to hire people to run these sites. And so the Wayne County Health Department, first of all, we reached out to Reed because we didn't think that we would be able to do it, but some things changed. And the Wayne County Health Department will take over the testing site come September 1. But it should be seamless, and the community will know no difference because we will continue to serve out of the old Elder Bierman building. But a good thing is we're going to move all of our clinical services over there. So it'll be a one-stop shop for people. You can get a COVID test, you can get a flu shot when those become available, you can get your immunizations, lead testing. If you just want to come in for a blood pressure check, you'll be able to do all of the services that the health department offer at the Elder Bierman site. We're going to change it around a little bit. I thought that it would be best to bring our COVID testing people in through a separate door than our immunizations. So there'll be a little bit of flip-flop where you'll come in the north side to get a COVID test and the south side to get immunizations. But it should be pretty seamless for the community and no gap in testing. And that was one of the things that we worked very, very hard to make it seamless, where there isn't a 2-3 day turnaround where people in Wayne County are searching to get a test. And also I wanted to keep it at the same site. I didn't want people to be frustrated, because it is frustrating when you think that you're sick and you want to get a test and you show up and you had no idea that the site moved. So I think continuity and services is important to have for the community right now. So we will keep it there.
Now, I would point out, I just happened to have gone by the Optum site on my way to the studio today. I test myself periodically, but I haven't done it at the Optum site before. And I thought, well, I think I'm going to do that this time to experience it for myself. And I have to say, it was super fast and easy. There was no discussion of money. The people were very nice. And I was in and out of there in under 5 minutes, I'm sure. I didn't time it, but it was very quick. So
did you make an appointment?
Pardon me?
Did you make an appointment?
No, I just walked in.
Yep, good.
And that didn't seem to be a problem from their perspective. So, I commend it to people to utilize that resource while it's there, and I'm sure you'll do a great job when you take it over. And I want to point out that
I hope so, because they do, like you said, they do a great job. They are going to be a hard act to follow, but hopefully we're going to try to keep similar hours that they do, and even actually offer Saturday hours come September.
You mentioned that originally the discussion started with talking to Reed, but you figured out a pathway, and that's fine. And I want to point out, for the benefit of any viewers in the Connorsville area, that Fayette County is looking at also leveraging the grant opportunity. For that, they probably will continue to work with Reed, and there will be a plan there for whatever follows the Optum site. Currently, they're at their National Guard Armory. Whether it will stay there or not, I don't know yet. But there will be more news on that as we go forward.
Yep.
Christine, one quick follow-up, if I could.
No, go ahead.
The lab results are coming in pretty quickly, and I can tell you from personal experience what you're hearing as far as people testing on the 22nd and getting their results today is accurate. I got mine this morning, and I tested on the 22nd. Are you going to be able to keep results coming through that quickly? Will it change the lab that these are going to, or anything of that nature, when the health department takes this over?
That's a great question. We'll be going to a different registration format. It'll be a Zotec registration, but it will be, we're told, very similar to OptumServe. And the turnaround time should be exactly the same, if not better, is what we're told that ISDH will be able to do. And so we are hoping to do as good, if not better, than the OptumServe site. And like I said, I've never had any problem. And I test regularly. I was just tested yesterday. I actually went to First Care and got a rapid test yesterday. And that was a quick turnaround time, and got a negative test result from that. So the testing is out there. I wish that we had rapid testing at the community site there at Optum, and we're in the discussions with ISDH to eventually have that. I think that with bringing the kids back to school, I think quick turnaround times on testing is important. But I did want to talk about some of the numbers that we are seeing, and maybe try to put it into perspective of this peak, that we're seeing. So I ran some numbers from Sunday to Thursday, because I'm always a day behind. So when I talk about numbers today, they're actually who was positive yesterday for us. So to this week, we have, from Sunday to yesterday, we have 71 new cases. And when I ran those numbers for last week, that exact same time frame, we had 35 new cases. So you can see, and that was a lot. We were panicking at that, not panicking, but we were reacting at that point of here we go. I think I said in a meeting, the wheels are officially off the wagon. And so we are in a steady, steep incline in cases right now. In just those 2 weeks, in the previous 2 weeks, we're also seeing that incline in Wayne County. And like I said, we had been going along with getting 2 to 3 new cases daily to suddenly, getting 15 to 26 new cases a day.
Okay. Anything else? Christine, we're going to let you get back to work. Thank you very much for joining us. We appreciate it.
Thank
Christine Stinson, Executive Director, Wayne County Health Department. Before she goes, one more quick plug. Tomorrow from 12 to 3 in 3 different locations. The PACE Center on the west side, Reed Health PACE Center at Elstro Plaza, and also at Test Middle School between 12 and 3, a clinic where you can drive up, get a box of 50 masks to take for each home.
And the signs, too.
And the signs, too.
Yep.
All right.
All right, thank you.
Thank you. You're watching Ask the Doctors on WGTV Channel 11, WCTV Channel 21, streaming on Facebook Live, also available on CTV3 in Connorsville. We haven't asked the doctors much so far this hour, and we are over halfway done with the show, so let's start asking some questions. Can we clarify what a COVID-19 related death is? Can we clarify what a COVID-19 related death is? And I know that this is a question that has been asked a lot on social media this week. So
this is a good question, and it's a tough question. And one of the reasons it's tough is because it's often hard to determine a cause of death before COVID ever made an appearance. Every doctor that loses a patient, if it's a patient in the hospital, you're asked to fill out a death certificate. And on that death certificate, you're asked to put the cause of death. And then it will usually be secondary to, and there may be there's an opportunity to list contributing causes of the death. If it's a death outside the hospital, the coroner or the some people have I don't know, the titles in different states that I'm not sure exist in Indiana, but there are other people that may ask to determine this. Many people argue, somebody comes into the hospital and, for instance, and has a heart attack, and they also have COVID. So we found that the argument earlier was, well, they died of a heart attack. The COVID didn't have anything to do with it. Then we find out later, as Tom says, we always get more information, that COVID can cause clotting problems. So we see evidence of stroke, loss of limb, heart attacks in younger patients that wouldn't normally have this listed. I think one of the it's hard for people who keep track of this, epidemiologists, people that are trying to project trends. They're very interested in this information, and it has some political overtones. So I noticed the other day in Colorado, people were accusing the state of reporting too many COVID-related deaths. And then I saw in Florida, people were saying the state was underestimating the number of COVID deaths. We know that we're going to probably get the final handle on this when all this is over and we look back on it. One of the things that points to COVID-related deaths is, and I'm just talking about deaths, there's an expected mortality rate for the country. In other words, on a typical December, in a typical year, there are this many deaths. And we noticed that there was a spike of deaths in January when COVID appeared that was much above the expected mortality. And we also noticed that there were more people that died at home. And it's suspected that many of these people had COVID. Some people argue that as the virus went on, that many of these deaths at home were people who had heart disease or other problems that didn't seek medical attention because they were afraid of getting COVID. So there's that aspect of it. I think in the main, most people feel that the number of COVID deaths is underestimated rather than overestimated. But I don't think there's anybody at work here from a political standpoint that's trying to skew the numbers one way or the other. I think the people that are looking for these numbers are scientists. They just want the truth. The answer to your question is, you know what, we don't often know if this is truly a COVID-related death. The person may have many other problems, hypertension, diabetes, lung disease, but the straw that broke the camel's back, so to speak, may well have been COVID infection, and so that death would be listed as a COVID-related death. Do you have anything to add to that,
Yeah,
Tom?
I mean, as to how they're counted, it all boils down to how it's listed on death certificates. And I would point out that we didn't actually have the ability to fill out death certificates to list COVID-19 as a contributor or cause of death until they made some changes to the way the system and actually, were able to generate an ICD-10 code for, came up with an ICD-10 code for COVID-19. So there was a lot of confusion in the initial phase of the pandemic about how to certify a death as being related to COVID-19, and that's been clarified. But what that tells me is that we have a whole period of time where certainly the deaths are probably underestimated, at least a period of time. And since then, there can be other reasons to underestimate the deaths as well. On the other side of that, we get into this whole conversation about, well, what is a COVID-19 death? Let's say somebody dies and they have a positive COVID-19 test. To me, there are three possible relations of COVID-19 to that death. One is that it caused the death. They were maybe an individual who was the stereotypical patient that came down with a viral pneumonia, wound up in the ICU, could not be salvaged, and died, and that'd be a clear-cut COVID-19 death. But then you've got the second possible condition, which is they have a lot of other issues and maybe died of heart failure or died of, stroke-related complications, but it was aggravated by having active COVID-19 infection. There we can see the COVID-19 is related, but was it the cause of death? I think, you have to go through this exercise to kind of sort of figure that out, and that can be hard for the doctors to do. The third possible relation is I die in a car accident, I happen to have tested positive for COVID-19, I died with COVID-19, not because of it. And so it can be tricky kind of figuring out what relationship the COVID-19 has.
I think that's key. That did he die with COVID-19 or die of COVID-19? That
Yeah,
was a
I mean,
very
so
succinct point.
somebody has to apply, a mental process to kind of determine that, and that's the doctor who, ordinarily, it's the doctor who certifies the death, or a coroner if the doctor's not doing it. And and so because we have people involved and it's judgment call often, there can be variability in how that is done. So it's not a clear-cut black and white kind of process. So it's a lot more gray than I think people realize. When you add all that together, we have the likelihood that there's overcounting in some cases, undercounting in other cases, and I think it's all going to kind of wash out personally.
Yeah, and one final point, we have only about 20% of our cases come to autopsy. It may even be less than that. I think Mount Sinai Hospital in New York offers free autopsies, and only 20% of patients' relatives take advantage of that. But it's, if you take out a lung of a COVID patient with COVID, and it weighs 3 times a normal lung because it's full of water and cellular material, then you pretty well know that patient died from COVID. But there are very few forensic pathologists anymore. There's a great shortage and very few autopsies are done, so that's another factor.
Do you have the same issues? Because this has always been talked about as this is just another case of the flu, and I know we've gone that that's not the case. But when people die from or with the flu, do you have that same subjective conversation in reporting flu deaths?
I think so. Dave can certainly weigh in.
There are many more deaths than the public realize that are, the patient may have many diagnoses, all of which are potentially fatal, and you come down, there's that death certificate in front of me, and you want to know, well, what did the patient die from? The patient with thickened lungs, you'd probably say respiratory insufficiency, he couldn't breathe. And then it'll be secondary to what? Well, pneumonia was secondary to what? You might put down pneumococcal infection, or you might put down COVID, but it backs up from the ultimate cause of death at that moment, and doctors do the very best they can to give the most accurate cause of death they can, but it very often is subjective because we don't have a magic genie that tells us what was that final straw that broke the camel's back.
Yeah, so to that point, a lot of it's done on probabilities. We don't have all the time rock solid evidence, and we're not going to go through the steps to try to do that with autopsies and very sophisticated testing and so forth. That's just not practical. But the reality is with influenza, yes, people can die of influenza. Once in a while, somebody dies of an overwhelming influenza, viremia, and viral pneumonia. But most of the time, deaths during flu season are people with underlying comorbidities that puts them at risk, and they get flu, and that exacerbates their problem. And so they fit into that second condition I talked about, where if you get an acute illness on top of certain chronic illnesses, then your likelihood of dying from that, an acute complication of the chronic problem, goes up. And so that's why during flu season we see a lot more deaths during the winter time when flu is around. But they're not necessarily dying of influenza. They get it sick with influenza, but then they've got exacerbation of their heart failure and they die of that or other things. So that makes the statistics keeping for influenza tricky to do, and makes it to be a lots more subjective process than anybody would like. And then on top of that, you have to realize that not everybody gets tested for influenza. That influenza testing is widely available, But, typically what happens during a flu season is early on, when we think we're starting to see it, we'll do lots and lots of testing. But then the normal thing in a seasonal influenza outbreak is, okay, once we're certain that it's well established in the community, then when somebody has compatible symptoms, we just treat them for it. We don't necessarily test everybody. And so for that reason, the state and national statistics have to be, they have to kind of model that, because they're working with incomplete data. Not every flu is reported, and not everyone gets tested, but we know that it's out there more than what the official testing and reports indicate. And so they have ways of adjusting the numbers to try to more accurately represent what the actual numbers are. But it's a scientific method to try to work into what that is rather than directly testing people. So the whole area of the statistics with respect to influenza is very complicated. It's actually, I think, going to be more complicated than what it will turn out to be for COVID-19, since we're trying to test everybody and anybody for COVID-19, and that doesn't always happen in a flu season.
We've got about 13 minutes left, so we're going to try to get through a few more questions, and we also have some of your graphics this week. So next question up, on elective surgery, should we wait until numbers go back down? I know that you kind of talked about this on our Facebook page a little bit last week, but real quickly.
Yeah, if I were in need of an elective, quote-unquote, surgery, but it's still, I'm not sure I like the term elective, because most of the time we're talking about things that people need. They're just not an emergency to get right now. So the question is, what's an appropriate timing? I would go get my elective surgery as soon as it's practical to do, simply because I know that we seem to be in an upswing, and I cannot rule out the possibility that there'll be a lot more in the community, and that in a few months or in 6 months, I don't know what the numbers are going to look like. I know that right now we're relatively low compared to what we're going to be in the near term. And so I would do it soon rather than waiting, because if I wait 3 months and things are a lot worse, maybe I can't even get it, because the hospital, any health system, has had to back off on elective surgeries and so forth. And I could have done it now a lot more safely than I might be able to in 3 months.
Okay. Next question. Let's keep moving. How long after exposure do you need to possibly test? If a person was around someone on Saturday who on Monday tests positive, is Monday too early for me to test 3 days after exposure? What's the time frame where people think they've been with someone that tests positive? How far back should they go? If I was with you 2 weeks ago and you just found out that you tested positive,
I think
I
would test maybe in that 3 to 5 day time frame, 3 to 7 days. The median onset from exposure to symptoms is still about 5 days, is what the statistics represent. And but we also know that people who test too soon after an exposure are much more likely to test negative but then be positive later on. So there is a sweet spot in there somewhere. I think it's probably, I would wait 3 days minimum, maybe around day 5 is what I would do. I don't know that anybody knows exactly what that interval should be, and I guess I should, caveat my statements with, it's possible there's a thought on this or guidance on, say, CDC's website or the state's website that I'm not aware of. But I think it's probably going to say something like, 3, 5, 7 days, something like that is what I would wait, minimum of 3 days.
Okay. Let's get one more question in before we go. Would face shields be permitted in school for small children in place of masks? Would they be effective? They might be easier for them to tolerate, plus protect their little eyes. Just curious. So if the schools say face shields work for kids as opposed to putting them in a mask, your thoughts, Dr. Jetmore?
Yeah, I think they may be permitted, especially you may have some, the younger children are less tolerant of masks. I think part of the question is, are they as effective as masks? I would have to say no, they're not. However, I would think they would be more effective than not having that shield. I think in some instances they may be very useful for students who are getting speech training, because it's imperative that you see the teacher's mouth in watching them form words. So you'd need to see the face shield in that way. I still think wearing the mask is kind of the gold standard in preventing these respiratory particles from going out. The mask is not going to let them go directly out. It's going to drive them down toward the floor. So is it going to be beneficial? Yes. Will it be good as a mask would be? I don't think so.
Well, I think that's right, and I think the CDC's guidance on this, I happened to have just looked at the other day because the questions come up in a couple of other contexts with me in different situations, and the CDC's guidance today is face shields by themselves are not recommended as a general principle. They can add value when worn with a mask, because of the things that the writer of the question mentioned, protecting the eyes, and may actually, in certain situations, like in healthcare situations, where we want to keep an N95 mask clean and extend its use, where having a face shield over that can actually extend the usability of an N95 mask. There was a report that was just published a couple of days ago about a Swedish hotel where the staff did not wear masks. They all wore face shields. And they had an outbreak of COVID-19 amongst the staff and some of the guests associated with that. And so the Swedish equivalent of our CDC has said that no face shields alone. It's masks plus face shields if we want to use a face shield. So, but to Dr. Jetmore's point, there can be some situations where, you need to have, be flexible about it, and that's true too.
We've got about 6 minutes left to go. I know that you have been on a weekly basis updating us on some of the numbers. I think we want to get that in, particularly since you, Dr. Jetmore and Christine have all said you've seen a spike in numbers. I think we want to try to show those numbers to the community so that they understand completely what's being talked about.
So we'll start with this one real quick, and I won't make too much of it. But this is the read volumes that I've been bringing. I also added 3-period moving averages, and maybe when you add a moving average line, an important thing that you can do is you can say, is the current are the current numbers above or below the moving average line? And obviously, if they're above, that's a problem. And we can see in the last 2 periods, the weeks ending last weekend and the weekend before, that the numbers are basically all above their moving averages, and that's a trend in the wrong direction. You want to move to the next one, Ryan and Stephen? And then if you hold the back off on this, because we've had the increase in the last couple of weeks, I also broke out the last 21 days or so, and we can see that specifically in a little bit more granular detail what's happened over the several weeks, and we can see that we have increasing numbers at read. Nowhere near overwhelming, but it is causing a little concern internally. Move on to the next one. These are the Wayne County numbers. I think I brought a version of this last week when we were at the 21 bar, and that looked, bad enough. But now adding the totals through last weekend from the Wayne County positives up to 41, essentially doubled the week before. And Christine mentioned on the Zoom dialogue with us that actually so far this week we're probably going to be nearly twice that again this week.
Well, she told me if you count clinical cases and lab positive cases, I think last week there were 35 and this week there were 71, which again is a doubling, just a difference.
Right. So, and I did want to bring a graphic that we've worked on at Reed, an educational graphic that will be available on our website, or should be there now at readhealth.org/safe, that everybody can see. You have to go study this, but basically what it, in succinctly in one page kind of captures the whole theory and practice behind masks, starting with the knowledge that a lot of people who spread the virus don't actually know that they're doing that. And we have a reference to a scientific publication as one example that you can go look up and see if you want to on that. On the right side of the graphic is the sort of different conditions that you can get into. And obviously the maximum exposure is if somebody who's carrying the virus is not masked and somebody that they're interacting with is also not masked. That's where the maximum exposure happens. If the next one down, if only the healthy person wears a mask, that's probably better than nothing, but it's not great. The risk is still high because you're still getting the particles moved over to the healthy person, and and there's still exposure there. But it's better than nothing. We move down to the third frame down, and we've got only the carrier is wearing a mask. That's actually better than the healthy person wearing a mask because the carrier is capturing the vapor and the droplets and keeping them close to him or herself. And then, of course, at the bottom frame, the best situation is when everybody's wearing a mask. Not only is the carrier not emitting out into the general area so much carrying particles, but also the healthy person gets a little boost by wearing their own mask. So I recommend we all go study that to kind of understand what the value of masks is. They're not perfect, but properly used, they make a big difference.
Is there benefit, real quickly, to the fact that it seems like younger people are the ones that we're seeing get sick right now? I've heard that the numbers are younger people, and they seem to be able to fight it off better. Is there any?
So we've always known that younger people don't tend to get as ill, but they can get sick. It's just that the serious complication rates are higher in the much older folks. And that may be, and we know that we've had a shift in the age demographics. I think my concern is that while it's good to know that while the positive tests are high, the overall severity seems to be lower, that's true and that's good. But I think the risk, though, is that younger and middle-aged folks may get overconfident and carry the virus to people who are more at risk, and then we'll have a much worse problem.
Dr. Thomas Huth, Vice President, Medical Affairs, Reed Health. Dr. David Jetmore, Wayne County Health Officer. Gentlemen, thank you very much. We're going to kind of play musical chairs. I'm going to take myself out of this equation for the next couple of weeks. I think Dr. Jetmore is going to move into my spot. Christine Stinson will also be here as we continue with Ask the Doctors over the next couple of weeks. Remind you of the mask distribution taking place tomorrow from 12 to 3 at 3 locations, the Reed Pace Center, Elstro Plaza, and also Test Middle School. Thanks for watching. Be safe, be well. I wish you well.